Good evening, everyone. Based on the gallery of people I have online, I do not see Mr. Conaby. Mark, if you're online, please let me know. Hmm. Oh, I see Mark just appeared. So, um, welcome, Mark. We have a full board, so we'll proceed with tonight's agenda. I anticipate tonight's agenda will be pretty straightforward. Things keep moving rapidly, changing rapidly, so I thought it was worthwhile to hold a meeting and get an update for the board. Other than the minutes, I don't anticipate taking a recorded vote, but unless the board feels we need to take action on a particular item. But so hopefully this will be a relatively straightforward meeting. And in terms of meetings, I just want to announce we have a meeting Thursday, and which, if not necessary, we'll cancel, but if necessary, we'll hold. And then the following Monday, a week from today, is actually a state holiday, so staff will not be available. So I asked Cheryl to please post a meeting for Wednesday of next week, being in about the middle of the week, and it'll take the place of our normal Monday and Thursday cadence. So hopefully that's acceptable to members of the board. So with that, we will plunge into tonight's business, which begins with an update from Cheryl as to new developments.
Hi, good evening, everybody. So quite a few things went on since we've last met. One thing, our building commissioner drove around town and checked out some construction sites for us. Found 2 sites without any proper protection, and he shut them down. And then he found another site that had the proper PPE, but they weren't all using it. So he made sure they all put it on and did what they had to do, and then he left. So he's going to check again in the next week and follow through on some others just to make sure that that's happening, which is we're thankful for that they're helping us with that enforcement. So the other things that have happened is we put some signage at the Arboretum and closed some of the parking. I was there this weekend. We did print out the one-way signs, and we have a plan in place to make the trail one-way, but the signs were too big and we were having a blowing problem. So I'm going to go in the office tomorrow, print some new signs. I'm going to get those up tomorrow. We did not put the signage on the rail trails in total miscommunication, so that's also being done tomorrow as well. All conservation areas are currently posted. I included later in the day, I sent a food service, what do I call it? Sorry, food establishment list that we sent to all of our restaurants and our stores today. So this was basically a compilation of stuff that we have been emailing our businesses in the past couple of weeks. Matt took the time and typed up this document, so we included that this morning as well. So that basically is all the stuff that we've asked them to do, the shields at the registers, social distancing posters, as well as entry doors being posted with social distancing. And then the new thing that we put on there was the one-way aisles. So we do have some compliance with that at this point, but some stores just got that notification today, so we expect more compliance with that. We also suggested that they take money over the phone or on online orders for our restaurants that are offering takeout, just to avoid the contact. So that document is, you got sent later today. We'll get that posted on DocuShare later as well. Along with the CDC, Governor Baker this week has also suggested that anybody going out in public wear face masks or some kind of face coverings. So one of the items that I was going to talk to you about tonight is potentially enforcing that order. We do receive a few complaints about, specifically grocery stores not wearing the employees not wearing face covering. So it's just something I wanted to talk to you guys about tonight. The governor had a press conference today where he spoke about a new manufacturing initiative. So it's basically they've freed up some money and they're lending it to some current manufacturing companies to help make PPE, hospital gowns, swabs, thermometers, and stuff like that. So he specifically talked about a few companies, specifically like New Balance is now helping to make face masks, just for an example. So it's a great initiative, and it seems like it's really positive to some of the manufacturers out there. Let's see. I think that's all I have. Yeah, that's all I have at this point.
Okay, well, thank you, Cheryl. You said you'd like to get the opinion of the board on masks. Could you just help me a little bit, because I'm not as familiar as you are with the governor's. Is that an advisory or an order? And was it specific to grocery stores, or was it, all citizens when in public?
It's not an order. It's I forget how he worded it, a guideline or a recommendation. I'm just wondering how the board feels about making that an order versus a recommendation.
Okay, well, unless the town is prepared to issue face coverings or masks, I think it would be, this is just Bill's opinion, I think it would be difficult to make it into an order without having the means for people to comply with the order. But I see Dr. Taylor has unmuted his mic, so that means that he probably has something to add. So, Dr. Taylor, you have something to add?
Not in the mask discussion. I mean, I agree with what you're saying, and I think the mask helps those who are ill. And of course, the people working the grocery store would be turned away if they were ill, as would the people coming in. So
I think it certainly, I don't know, I'll phrase this inartfully, but I certainly think it helps give confidence to members of the public if grocery store workers are wearing a mask, because they feel that the transmission of viruses onto their packages of food is probably reduced. And, I think we could certainly encourage the grocery stores to provide masks for their employees. And I think it's ultimately in their own interest to do that. But as far as citizens in public, I think that would be difficult. But thank you, Dr. Taylor, for your opinion. I see I'll work from the bottom of the list to the top. Mark, would you care to add anything, or are you all okay?
I think we should encourage the folks to wear the masks, because obviously it helps those that are potentially, or who are testing, would be positive in shedding the virus, would help protect others in public. So those who do not realize that they are positive and they can transmit the virus, it's very helpful. Just background, certainly you can require of the businesses, if you can require them to close, you can put a lot less restrictive means of requiring the masks. And there are a number of other communities, Salem's one that just comes to mind off the top of my head, that have already required it. But I guess the preference would be to encourage and strongly urge folks to use the masks and protective coverings. And that was the other point I was going to make, Bill. They said people could use scarves and other things, so there wouldn't be an impediment to ask folks to wear a face covering if it was defined broadly. It would just be a public health recommendation, which could easily be enforced, but the goal is compliance, not fines.
Okay, thank you. Joanne, would you care to comment, or you all set?
I'm in agreement with what Mark had said. I think, again, strongly encouraging, but not requiring, because then it becomes all about enforcement and not education. So I think, the more outreach we can do, the better.
Very good. Mike?
Hi, Bill. Yeah, just a few points is I think the data is still suggesting that face masks really don't help a whole lot except for first responders and people who are actively ill. But just a general question, I mean, requiring masks, I would have no idea where to get masks.
Right. I think that's one of my concerns as well.
And I'm not sure that businesses will actually have access to masks. Because honestly, the priorities should be getting masks to where they're needed, which is in the hospitals, which is in doctors' offices, which is first responders and Acton public nursing. So I think to encourage people to take these masks out of the supply chain is, there may be some unintended consequences with such a recommendation or order, but that's just my thought. I think people could get by honestly with social distancing and taking reasonable precautions.
Well, Mike, I think Mark raised the issue. It doesn't have to be an N95 mask, probably shouldn't be, but you can use a t-shirt, a bandana, a scarf. You can make it at home.
But again, I don't have any of those at home. I don't have any bandanas. So the other thing is
t-shirts.
I mean, Dr. Bill, you seem to me to be a data-driven guy. Are you aware of studies that bandanas or t-shirts are actually effective?
No, I think what the psychology of wearing a mask. I mean, certainly in China and the Asian countries, everyone has been wearing a mask because of the SARS epidemic. We didn't have that, so we're a little bit more casual about it. But I think it has sort of a confederacy against the epidemic.
Okay, Rika.
Yeah, I think the mask does provide protection, especially if a individual is asymptomatic. They cannot transmit the infection. So I would go with Mark's comments, and I would encourage everyone to wear a mask. It can be anything. You can use a handkerchief or a scarf or a t-shirt or just a piece of cloth. And on CDC website, they have given the instructions to make a mask. And the mask doesn't have to be a surgical mask. It can be anything that can provide protection.
Okay, thank you. Tom?
Yes, I believe it should be a recommendation, but make it for the general public, but make it a very strong recommendation for employees at the various markets. I don't think it should be an order because there's no real way to enforce it.
Okay, thank you. Cheryl, do you feel you've got enough of the sense of the board's opinion, or do you need more concrete guidance?
No, that's fine. One of the reasons I brought it up is we've had quite a few, correspondence from the public asking us to make this an order and to require grocery store workers to wear them. So we have sent out, besides the document that's in front of you right now, we have sent out emails strongly encouraging grocery stores and all stores employees to wear them. So we've done what you suggested. I just wanted to make sure you didn't want to bring it to the next level.
Okay, thank you very much.
Bill, I had something I'd like to add.
Sure.
The governor's discussion today. Apparently, they have started mobile testing in all long-term care facilities, which includes nursing homes, group homes, as well as assisted living. And the National Guard has been involved in that. And this is part of the issue of when they identify positives, they're going to set up, I think they've already set up a few new nursing homes that were formerly out of business, and they're recruiting staff. And then they're going to have nursing homes just with COVID positive patients, and then nursing homes with COVID negative patients. So that's been a lot of effort in trying to identify early risk of infection and transmission in those settings.
Very good. Okay, well, thank you. So at this time, I think it would probably be worthy to move to our next agenda item, which is an update from Heather at the Acton Nursing Service as to how things are progressing in our fight against the COVID disease in town. At which point, I'll ask if people after polling members of the board, I'll ask for questions or comments from members of the public. So Heather, if you please.
Good evening, everyone.
Good evening.
Good evening.
If I could just make a comment to what you were just discussing about the mask, I just wanted to throw a comment out. The disease tracing now includes any contacts of a positive case 48 hours before they were symptomatic, because looking at the data from other countries, they're finding that contacts that people who didn't have many contacts, but folks that they saw the 2 days before they were symptomatic have been coming down with the virus. So they're guessing at this point, really, and they're recommending that we do the contact tracing to those folks up to 48 hours before a positive is symptomatic. So they are looking at that. So just my comment about the masks, I think really trying to encourage the workers to wear them because they are standing in one spot all day. You know, they're breathing, they're talking on all the apparatus that people are putting their hands on. It's just a thought, you know, if down the line that has to be done, I think it's probably a good idea. Some face covering would be helpful.
Okay, that makes sense.
Yeah. So we now have 39 positive cases in Acton, but I did want to mention, because someone did ask me the other day how many people had recovered. I can tell you that currently under surveillance, who we are monitoring, there are 27 positives that we're monitoring. So quite a few have fallen off as, you know, a couple of weeks have gone by now since we started really digging into this. So that's good news. There was a delivery over the weekend to the public safety facility of PPE equipment, which included N95 masks, surgical masks, gloves, gowns, face shields, booties, goggles. So that's really great. I know that Mark Hall, the assistant town manager, has been working with MEMA directly. I think he's in touch with them almost every day, and they put an order in and get, he gives an update of what our total PPE that we have on hand still is. And then the team is basing everyone in the state on how they refill those orders. So I did, and I heard Dr. Bill mention about the testing that's starting to be done at Life Care, the assisted livings and the nursing homes. And I did talk to Life Care today, Chris Foy, and his nurse manager, Kenny, I can't recall her last name at the moment. We had a long discussion about things that are going on within the building. They're doing an excellent job. I mean, they're doing things to the point that every time there's a change, they're stepping their own policies up. As an example, they were screening at the beginning of every shift. Now they're screening at the beginning of the shift and the end of the shift for staff. They've been wearing N95 masks while working for the last 9 to 10 days, which is which is wonderful. They also are doing testing. They did have one client within the facility who started showing symptoms of COVID-19. The family opted not to move them and have them tested at a hospital. So they did the testing there themselves, which was great. But they also isolated this resident, and the residents who shared a room with this resident, and then there was an adjoining bathroom and the room attached to that. All of those folks are on quarantine now, and there's only one nurse a shift assigned to the quarantined 2 rooms and the isolated room. So they're really going above and beyond, which is great. I think they're doing a great job. So they have tests that they're doing within the building if they need to, which they did with this person. And they've also tested the other quarantined residents that aren't showing symptoms, but they did do the testing. And they're working with Kim Shallows, I believe her name, over at Emerson. So they'll shuttle those tests over there for the lab to work on. So I think that's great news. I think they're doing a great job. Even to the fact of their food service, they're not even bringing, the people in food service aren't bringing them into the respective wings of life care. They're actually leaving the carts at the end of the hallway, and then the staff on the floor are passing those out and bringing them back. So they really have a good handle on what they're doing over there. It was pretty impressive. So that was good news. I did speak with Robbinsbrook also over the weekend, as there was one resident who did test positive, who had been transported to Emerson at the end of last week by EMS. So there was one positive over there. As far as I know today, I didn't get to check in with her today, and I apologize, but there was a lot of phone calls into the office. But I will check in with them tomorrow. As far as I know, that is the only positive case of a resident within the building. And again, they would fall under that guideline of testing can be done there instead of taking someone out of the building to be tested. Obviously, if they're sick enough to leave the building, they will. But if the testing can be done, at milder symptoms, the National Guard will start doing that. So that's really good news. I did have a call, and I just wanted to mention it. I guess there was a social worker who called me and left me a message today. She had been on the Board of Health meeting, I believe last Thursday, when the decision to close Narrow Park was decided. She, like others, were concerned about folks' mental health, being able to get out into the community, to do things so everyone's not shut in their own homes. I didn't get a chance to call her back. Again, I apologize. It was a crazy Monday, not with just this, but with the agency too. So I will follow up with her. But my thought on that was, she had some questions about how our disease tracking, if we are asking people if they think they know or have any inkling of how they have caught the COVID-19. And honestly, that's part of our disease tracking. Our disease tracing, we ask so many questions about where people have been, where they work, have they been in touch with people that, have the disease, all of those questions that we do. And the majority of people who aren't getting it, we do have quite a few, people that work in different medical facilities, doctors' offices, hospitals. So we're getting those positives, but within their homes, there's people that are becoming positive. But then there's people that have no idea where they've gotten it, and they haven't really gone anywhere except, maybe the pharmacy, the store, multiple stores though, trying to find things that they can't find. So they're making a lot of trips to different places, but they're also walking outside and going to the recreation areas. So they can't really nail down how they've gotten this because most people can't. They don't have a hazard like working in a hospital or as an EMT. So I just wanted to mention that the call came through today. And I completely understand both sides. But the part with NARA, and that was one of the reasons that you guys kept revisiting it, was that there were groups of people, not socially distancing. And that was the biggest point, not so much the rail trail or walking around the outside trail. It was more the groups of people at the picnic tables, the parking lot, all of those things. So I just wanted to mention it.
Okay, thank you.
Sure.
So any guidance for us, anything that you need from us that we can do to help in terms of policy, resources, whatever we can provide, anything we can do?
No, I don't think so. I mean, I think everything that you've done thus far, I mean, Cheryl's and her team are doing a great job with keeping up with the guidance and, getting out and talking to the people that need to be reminded of what they're supposed to be doing. The building department is doing that too. So I think all of those pieces are really great. And I think, so far so good.
Do you have a sense of how Emerson Hospital is doing? Are they reaching capacity? Are they, still have capacity? I think the data that I've seen says we're still a week away from peak resource use in Massachusetts if it follows the model that has been laid out.
Right. Yeah, we're definitely, they're saying a week away. I can definitely see by the calls that we're getting that things are sort of ramping up, with more people, on a daily basis, making phone calls, asking questions, maybe symptomatic and asking for, our advice and who should we get in touch with and where should we go to be tested. I think people are hearing, that the worst is coming. So I think, nerves are definitely, people are getting a little bit more nervous and paying attention to maybe something that they might not have thought was a particular symptom on a regular day, but now they're getting nervous that this may be, a true symptom of the COVID.
Okay. And I apologize, it's a bit of a repeat, but so Emerson is still coping with the demand from the community?
I didn't answer that. As far as I know, they're not at full capacity, but I haven't talked to them this week.
Okay, thank you. This time I ask if members of the board have questions or comments, and I'll go the other direction. Dr. Taylor.
Yes, Heather, this is Bill. How are you?
Good, Bill. How are you?
Good. I'm interested in your follow-up on contacts and how has that gone? How frequently do you call them during their quarantine, and what kind of things are you looking toward?
So the guidance from the state is that we don't have to call as often as we are, but honestly, it really depends on the patient and what the contact is. Positive cases, we're definitely calling much more frequently, especially those who are extremely symptomatic, just to keep an eye on where they are and if they need guidance. That's definitely the highest call rate that we're doing is on the positive cases. We have had a few people call in who reported that they were clinically diagnosed by their physician, so we're following those also, even though they haven't been tested. We've confirmed with their physician that they, absolutely diagnosed them, and we're following up and following their contact tracing also. The contacts vary. Some of the households do have at least one person who also is showing symptoms. It's typically at a milder level is what we've been seeing than the person who was positive within the house. And again, we're following up as frequently as needed with them. Some folks are pretty confident that they're okay. They don't need a phone call. Let's put it off another day or two. But they all have our contact information, and I encourage them all, to call with any questions. So it really varies, Dr. Bill, on the symptoms of the person we're following, because there are a lot of contacts that we're following that have no symptoms.
Yes, okay. Have you identified any household transmission from a contact?
Yes. Yep.
Okay.
Absolutely.
Yeah, that's the critical area.
Right.
Yeah.
Right.
Good. Thank you.
Thank you.
Tom.
No, I don't have any questions, Bill. I'm fine.
Okay. Rika.
I just wanted to ask Heather if they are like at the Emerson Hospital, do they have a separate ward for the COVID-19 patients, or all the patients are in the same ward? How is that at the Emerson Hospital?
I honestly don't know the answer to that. I haven't been in touch with them as much as I have been with our local congregate housing in town. I just haven't been in touch with them, to be honest.
Okay.
I do know, Reka, that the state is starting to publish the capacity of each hospital. I haven't seen where that is, but they're contacting how many cases they have and what's their capacity for additional cases.
Okay. Thank you, Dr. Bill.
There we go. Sorry, struggled with the mouse there for a second. Mike.
Hi, Bill. Yeah. Hi, Heather. Hope you're
Hi, Mike.
hanging in there. I'm glad to hear that MEMA's dropped off some PPE. That's excellent news.
Yes, very good news.
Yeah. I don't have anything further, but thank you for your efforts.
Sure. Thanks so much.
Thank you. Joanne.
I'm all set, thanks.
Okay, thank you. Mark.
Heather, thank you so much for the update and everything you're doing. We really appreciate it. I guess just a few things following up to some of your comments. The case tracing, and that's a lot of work, and as it's ramping up, are you all set there, or do you need additional resources or help?
Right now, we're doing pretty good. Mainly, myself and Linda Cullen are making the follow-up calls and following people that will take flip-flop cases back and forth as they come in, and follow that case in the household and trace the contacts. The positive thing that we're seeing is that for the most part, other than people who are essential workers, people really aren't congregating. The other thing we've seen is families that can, as soon as that positive case comes home, they're isolating as best they can, even to the point that if it's a smaller apartment, they're all wearing masks within the house. So they're really doing what they need to do, which is great.
Yeah, it's very hard when you have some of those close contacts in a small space. Like you mentioned multi-unit housing, there was concerns about that, people going into the common spaces and interacting. And is that still a concern? And you obviously indicate that you have families and in those tight quarters that are having a very challenging time dealing with that.
So I haven't heard from anyone in particular since the end of last week. I think when we talked on Thursday, I haven't heard any additional concerns. But it obviously will always be a concern during this time. In an apartment building, multiple people in one apartment, multiple apartments, all walking through the entry. Going to, if there's a mailbox that has mail slots, that's always a concern. I haven't heard anything since we talked last week from anyone specific, though. I'm not sure if Cheryl has, but I haven't heard anything myself.
We haven't heard from anybody, but we did send educational information to all the property managers for posting. So hopefully that's helping.
And read that there's certain other communities in Massachusetts that have requested folks that are in the multi-unit housing, and the same thing in New York, to wear masks in those common areas and everything else to try to minimize the transmission. And I guess we should probably be saying face coverings rather than masks to try to be a little bit more accurate in our description and messaging out to the public. And I guess that kind of leads back to what you said in the case tracings. There are folks where there's community transmission and they're involved in multiple trips to find things and out to the rec center. And I guess that kind of is getting back to that message of we're urging people to stay home and not go out except for essential purposes. So it's kind of like they're doing that and they're picking up the virus. So that's a large concern. And I guess it's kind of cycling back to the message, please stay home, especially during this period where we're ramping up with a tremendous amount of cases and the escalating basis and the limitation on our resources.
Okay.
That's a really good point. I will tell you, because I did get a question from a resident who knew about a positive case because they were a neighbor and knew that the spouse was going out to get essential items, even though they're quarantined. The guidance is, even if someone is on quarantine, they are to wear a face covering out of the house to get essential items like food. They are allowed to do that.
Maybe we need to see if we can find a way to support them so they don't have to go out. They're not burdened and it's less risk to the public. So I guess that would be a nice public health initiative if we could try to do it.
Yeah, we always ask, if they need assistance, and people are, I think, hesitant to do that. But the COA and the school system is providing some meals to residents in the community. I know that for the seniors, Beverly Hutchings has, worked with different folks and even dropped off groceries to certain people that need that outreach. So it is happening. I just think that there's people are very private, so unfortunately, even though they're on quarantine, most of these people that go out with a mask or a face covering on, they're not symptomatic at that point anyways. So
that's the problem. They could be asymptomatic.
Right. No, I realize that, but that's the guidance right now from the state.
Yeah, I think that's the disconnect. The same thing goes with trying to minimize the contacts in the public. And then if they do have someone in the household who is symptomatic and or tested positive or clinically diagnosed positive, then trying to provide those services to limit their exposure and to reduce the time is very important. And let's see if we can try to help as much as we can with that.
Okay, very good. Well, thank you, Mark. All right, this time, let me just ask Dave, do you have any questions or comments? You're still muted.
Yes, sorry about that. No, nothing for me. Thank you, Bill.
All right, thank you. This time, Cheryl, I'll just ask if there's any questions or comments from members of the public. I saw a chat come in and I saw you responded to it, but I'm not sure if everyone could see your response or just us.
Someone asked, so right now the governor has ordered capacity, 40% capacity of the occupancy load for grocery stores. But the person on chat asked about like doing the same for CVS or those kind of facilities. So what I responded was we could reach out to them and suggest they do the same and offer, count the people in the store. The person on chat identified that there was quite a few people in the store at the time. So we'd be happy to reach out to them and offer the same type of suggested guidance that the governor has for the grocery stores.
Seems reasonable. I mean, if the idea is to prevent people from all occupying the same space, too many people in the same space at the same time, that would be independent of the business.
Correct.
Could we maybe send it to the individual businesses what their occupancy is so they have an idea how many they should be posting and looking for to try to facilitate that?
We did that with the grocery stores, but yeah, we could reach out to the building department and find out what the occupancy loads are for some of the other stores. So yeah, we could do that.
Yeah, obviously people need groceries and the pharmacies and some of the other essential places. And it would certainly be nice if we could do that because, again, we're in that phase where we can reduce the transmission would be really important at this time.
Okay.
Okay, very good. Well, Cheryl, do you see any questions or comments from members of the public?
Yes, I have one call in user number 1.
Hmm.
Go ahead, Tara.
It's Tara from West Acton. First of all, thank you very much, and I hope that Heather and Cheryl and all your team are getting enough self-care, enough rest. Thank you very much for your work. I want to say something relative to the businesses, because I'm not one to impose too many regulations on businesses, but these stores, we have to go to the stores. And I hope that if you're not going to put an order, to at least put some kind of strong recommendation, that a firm guideline. I mean, you don't say don't spit in the food, right? But you can't enforce that. And we don't want them to spit in the food. And so, but there's a point where closing Narra Park seems like nothing in terms of the amount of contagions that are stuffed into these grocery stores. In Narra Park, the air is blowing around. It's nice. There's plenty of room to be socially distanced. But the stores, we don't have that choice. I really appreciate the one way, but I think that they've got to have some kind of face cloth, some kind of covering. There is a study, there's a couple of studies online, CDC type studies, that talk about these cloth types, and dishcloths actually come out above bandanas. So I just want to mention that. And then I'm hoping that you can disclose the number of cases and or deaths that are in the high density housing areas, because the folks that are living there, I think, should know when they go out in the hallways. I know that they can cover themselves and things like that to assume that everybody is sick or at least contagious, but I feel like that's information that's important to give people that are living effectively, right on top of one another. To be able to walk down the hallway, for example, how long do you wait, before the virus is settled? Those types of things are important to people that are stuck living there. Thank you very much.
Okay, thank you for the comments, Tara. Anything else, Cheryl?
That's it, Bill.
All right, very good. This time then I'd like to turn our attention to the minutes that we have from the minutes from April 9. I have no comments other than to just say there are those tricky words that sound alike but are spelled differently, aisle being one of them. It is spelled with an A. But other than that, I think the minutes were great. Any other comments on the minutes from members of the board?
I'm sorry, Bill. I couldn't hear what word you said was wrong.
Oh, aisle.
Oh, aisle. Okay.
It's spelled with an A.
Okay. Thank you.
Joanne, I see you have unmuted. Do you have comments?
I was going to move that we accept the minutes with the spelling error corrected.
Very good. Is there a second?
Second.
Very good. Mark is seconded. In that case, I think I can do this by voice vote. All those in favor of accepting the minutes, please say aye.
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 Excellent. I've heard a quorum of the members. Any nays? Hearing no nays, minutes are accepted. I believe that actually brings us to the end of tonight's scheduled agenda. As I mentioned, we do have another meeting scheduled for Thursday. Situationally dependent, but at the moment that's scheduled. This would be the last opportunity. Members of the board, comments, questions, concerns, general topics? Then if there are none, a motion to adjourn would be appropriate.
Bill, I'll move to adjourn.
Thank you, Mike. Is there a second?
I'll second it.
Very good, Dr. Taylor. Thank you. We have a motion made and seconded to adjourn. I see my face pop up in large, which means Mr. Taylor has terminated our agenda. Excuse me, Mr. Martin. All those in favor of adjournment, please say aye.
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 Aye. Very good. I've heard a
Aye.
majority of the members. Any nays? Meeting is adjourned. Thank you again, everyone. I'm hoping that in a future meeting, we can have good news. Heather will tell us that the number of cases is declining and, you know, we can start relaxing some restrictions. That will be a good meeting. Thank you again.
Good night.
Thank you, Bill.